chickpeas have actually been shown to reduce COVID risk because of the type of fiber in them. So there is such a thing as antiviral gut. And there is also some good research that the risk of COVID is decreased with a plant-based diet. The reason why that's so good for the gut is it actually helps build the beneficial microbiome, which is a key part of your immune system, but it's also a key part of the gut microbiome heart-brain axis. Welcome back, everyone. Hi there. I'm Dr. Jessica Drummond, host of the Integrative Women's Health Podcast. And today we have a very special case study for you. I was speaking at the American Physical Therapy Association's Combined Sections meeting earlier this month in Boston. And I was speaking about the integration or the intersection between COVID, long COVID, hormones, and menstruation in women. And Terry, who is a brilliant physical therapy student, reached out to me about her own struggles post-COVID, hasn't officially, from what I understand, been diagnosed with long COVID. But we want to talk about some of the things that can happen to the immune resilience after a COVID infection and what we can do about that, most importantly. So welcome, Terry. Go ahead and introduce yourself. And I would love to hear a bit more about how your healing journey has gone so far.
Yes, of course. Thank you so much for having me. Like you mentioned, I am a second-year physical therapy student at Duke within their physical therapy program. So prior to it's kind of funny how my timelines work because my first month here in August of 2022 for my first month of grad school was when I got COVID. I had made it through those 2 years of the pandemic without having it. And so I had COVID for the first time, August of 2022. I'd had 3 of my Moderna doses leading up to that. I had been working, around a lot of people until I came here, and I just had been able to avoid the infection, which I thought was super lucky. But as soon as I got here, a week of classes, I got pretty sick with COVID. And like you mentioned before, my undergrad, I can recall missing so few days of school just from being sick. And I typically, just the way my parents raised me, unless I'm throwing up or running a fever, I'm going to go to school. And so that's kind of how I lived. And I don't recall missing many days of school. I can remember my sicknesses in undergrad, pretty much mainly sinus infections and then typical dorm viruses. But this past year and a half has been pretty insane in terms of sickness. I've missed about 35 to 40 days of classes, which at the program at my level, it's been pretty challenging to keep up and to stay ahead and to not fall behind. So my first diagnosis, or first tested positive of COVID was August 2022. I was out for the 5 days that were required by my school. I recall my fever getting a little over 100, but that was my main symptom. And at this time, I'm very physically active. For a few months when I first got to school, when I was adjusting, I wasn't in the gym as frequently, but I do work out about 5 days a week, and I try and eat healthy, and I avoid all the bad foods and drinks they tell you about, trying to give my body the energy and sleep I need to do well in a program like this. But after that, so that was August, and I recall feeling just unwell a lot that fall after I was sick with COVID, but nothing was positive. When I came back in January of 2023, back to school after winter break, I got really sick again. My fever was 103 for multiple days straight, but they couldn't figure out what it was. They were just stress, maybe a viral infection. And they sent me on my way. Then in April of 2023, so just a few months after that viral infection, I had mono. And that was the sickest I think I've ever been. I was almost admitted to the hospital twice just because of how high my resting heart rate was. I couldn't get below 130 beats per minute. And I was super dehydrated.
For a couple of days?
Yeah, for a couple of days. It would to get out of my bed to go to the bathroom, I would get up to 140 beats per minute, which my resting is closer to low 70s. So that was pretty significant. I felt I felt like had just finished running. Each day I would just get out of bed and go up the stairs. So that was mono. Then in August, I got COVID again. So just a few months later, this time pretty similar. My fever was a little bit higher that go around than the first go around of COVID. Then in November, I got pneumonia and I was out for a week, and I was on breathing treatments and they gave me an inhaler. And I got multiple chest x-rays just because of like how sick I was at that point. And I'm still doing follow-up chest x-rays just to make sure nothing else is settled.
Mm-hmm.
Then, so that was November. And then January, I got flu A just a few months ago. And then a few weeks after that, I had what they called a rebound infection of the flu, where my fever was just back spiked to 104 for a few days. Really sick, very like just overall malaise feeling, just feeling really unwell. So those are my bulk of my things. I have been tested. They know for sure I have it. I was treated. There were a lot of moments in between that year where I just didn't have my energy that I usually did. I'd go to the gym and I couldn't perform what I could the week before. And there was no really syncing of my menstrual cycle to explain that.
Has your cycle been pretty regular in the last year? How's that been going?
I am on birth control and I have been since I was 13 for like a heavier period that I've experienced. So it changed a little bit in terms of how many days it would last, but it hasn't really changed drastically. I had a few months after the COVID infection most recently where it was a much like more severe period where cramps were worse, GI distress was worse, and my bleeding was heavier. So those are my main period changes. But like I said, I am on birth control, so I know there's some control through that.
Right. So you're on like oral contraceptives. So every month you're taking them with the breakthrough bleeding, that kind of thing. Okay, yes. Perfect. Okay. And then when you went, did you like go home for Christmas? Did you have any time off around Christmas?
Yes, we have 2 weeks off for Christmas with our program. So I went home for that time.
And did you, like, what were you doing then? Did you feel pretty well rested, that sort of thing?
So I had pneumonia late November. I was still kind of recovering for that whole month after, because I came back from, that happened right before Thanksgiving, the pneumonia. I lied really low Thanksgiving week, and then I came back and immediately started finals. So a lot of days of not getting much sleep and studying late in the library. So I kind of recall being pretty low energy that winter break. And then I stayed pretty cautious. I didn't see many people just because I didn't know what my body was going through. And by the time I got pneumonia this past November, I was a year into being just sick constantly. And so I was just having to rethink exposure because I had never had to be as vigilant about it as I had in that past year.
Yeah. And I think that's something that's very important to point out, that it's really challenging in the state that we're in right now in, spring of 2024, where we're 4 years into this, if you will. And most people, if they're not directly affected, although more and more people are at some level being directly affected, even if it's in this way that you're describing, like just kind of chronically getting sick, not officially being diagnosed with long COVID or diagnosed with a chronic autoimmune disease or anything like that, just sort of wondering like how to live. And I think that's an important thing for us to circle back to maybe in a bit, that, now we're having to start on an individual level, try to gauge risk because there aren't those more societal risk mitigation strategies like air quality or masking or things like that. And unfortunately, while the vaccine is a really valuable tool to prevent death, and even now in younger people who are vaccinated and boosted, they have a 6 times lower death rate, but the death rate from COVID in younger people is quite low. It's like 0.1 to 0.5 of 100,000 cases. In older people, I think the cutoff is 65 and above. It's about 12 to 13 per 100,000 for those who are unvaccinated and 6 per 100,000 who are vaccinated and boosted. So there is a protection level from either being vaccinated or at some level within a certain amount of time actually having and recovering from a COVID infection. There is some natural immunity, if you will, as well. But it's not really a sustained situation. It's not like, you get a vaccine and 10 years later, you're still protected. So we're all having to navigate this challenge of personal levels of risk versus societal mitigations. So we'll come back to that. But so basically, one of the things that I think it's important for all of us to understand that COVID does is it can dysregulate your immune system. In what exact way? I think we're going to learn. The research on this is not very clear yet, but we do know that in some people, they are later diagnosed with new autoimmune diseases. In other people, they are diagnosed with essentially chronic forms of COVID. There is a study that shows that once you've had a COVID infection, not in everyone, but in this group of people that were having continued variable symptoms, and some of those included chronic viruses and other viruses like you've experienced, COVID can live in the system in the same way that Epstein-Barr or mono lives in the system. Had you ever had mono before?
I had not.
That
no.
you're aware of? Yeah.
No.
So something like 95% of people eventually get the Epstein-Barr virus or a mono. Only 5% or so express a more long-term chronic expression of Epstein-Barr, but it's one of those viruses that essentially goes dormant in the body. In COVID, we've seen COVID reservoirs in the research up to just under a year, which was about as long as they did the study. And those reservoirs were in the brain, in the ovaries, in the cardiovascular system, like you name the organ, they found COVID, in the penis, like it's everywhere. And so, Epstein-Barr is at some level the same way in that it can kind of go into hiding and then later resurface or have a more chronic fatigue type presentation longer than just the acute 2 weeks or so of the virus. So I think we're going to start seeing different phenotypes, if you will, of long COVID. There are some people who just have a kind of low-grade active infection for months and months and months. They might even continue to test positive. They might have a low-grade fever. The good news is your body seems to be able to recover each time reasonably well. And, being in your early 20s, that's a nice protection
Right.
at a lot of levels.
Right.
Although it's not always the case that even young people just fully recover. So I don't want to, I certainly understand if they're in your 20s and you're dealing with long COVID, like I believe you, I get that. But in your case, Terry, I think that the fact that you're able to recover in between is a good sign that there is some immune resilience there, but we have a little work to do. And COVID might have just been sort of the straw in the sense that your immune system may have been stressed by who knows what, like moving. Did you have to move when you started graduate school?
I did, but it was I just am from South Carolina, so pretty quick move up to Durham. Yeah.
Okay. So a small move, a new program. Did you come directly from undergrad?
I did not. I took a gap year and I worked at my previous undergrad.
Okay. All right, great. So, these changes are some degree of stress. Is it an extreme stress? No, but it could be, sometimes we look at like, is there a combination of factors that may have hit the perfect storm for this COVID infection? One of the things I'm seeing in my practice around long COVID is that, so one thing we know, for example, it's interesting that you were on hormonal birth control. That can be protective against COVID infection, being on either hormonal birth control or estrogen replacement therapy is somewhat protective. And we have some interesting data from transgender studies of people who are transitioning from female to male were at a 4 times higher risk of even getting COVID than those transitioning male to female. So there's some protectiveness around estrogen, but it is possible. And I have seen this a couple times in my practice that maybe you were on the week of the breakthrough bleed when you got COVID. Do you have any memory? Do you know?
I think it would have been the week before my sugar pill based on my time in the month.
Okay.
Well,
so,
it actually might have been my sugar pill week because day 1 of classes, I think it was like half the week would have been sugar pill.
Okay. That's really interesting. So I've seen this a couple times. That's more anecdotal than evidence-based, but I think it is kind of interesting that if someone maybe had COVID 3 times and were perfectly fine, but their 4th infection, they happened to get in a low estrogen week whether they were cycling or now they were in perimenopause. That happened to me. I was in my early 40s when I had my initial COVID infection. There's a bit of vulnerability around that I don't think has been fully restored as much as it could be in the research. The other thing that has been found in the research is that every person with long COVID has low cortisol at the time of their COVID infection. So that's a sign of either acute or long-term chronic stress. I think many of us who are sort of high achieving, if you're at Duke Physical Therapy School, I'm sure that you're a person who has been maybe active, athletic, good grades. Tell me about your history of that. Like, you tend to be a good student, right?
Yes, I sometimes I have imposter syndrome when I think about the fact that I'm at Duke School of Medicine. But in my undergrad, I was more often than not in the library until 10 p.m., 11 p.m. Less social than some of my peers in some of those moments, but really focused on achieving this next step, which was graduate school. And I danced growing up, but other than that, I didn't do any other sports into undergrad. But I just remained physically active, just walks and runs and going to the gym. But I have had a very debilitating at times anxiety since I was in fourth grade. And I've been treated various phases of my life for that. At one point in high school, my anxiety kind of manifested into heart palpitations that would cause me to pass out. And then in like fourth grade, it manifested as I would just after we learned about storms one year in one section in fourth grade, and we had to watch this video about like tornadoes and storm systems. And then for about 3 months after, every morning I would throw up or almost throw up when I got to school because I was just like so scared of the storm and the impending doom. And that was my earliest memory of anxiety. So definitely cortisol levels have always been something that I've had that relationship with.
You know, another possible picture as we kind of look at some of the potential Achilles heels or like slight vulnerabilities that someone might have that would set them up during any given COVID infection to be in a more challenged immune post-recovery situation. Low cortisol, which if you have chronic anxiety, that can relate to the hypothalamic pituitary axis. And over time, especially since this has been since you were in fourth grade, you know, your cortisol could be suppressed. It could have happened. It could have been more suppressed by simply the stress of the COVID infection. So I think what I'm seeing clinically is that the COVID infection is often like a big fire that can reveal some deeper vulnerabilities that really weren't present. Like, you were a healthy kid, you were an active kid, you eat well, you studied, you weren't a huge partier. You know, there's a lot of things you were doing right. You were doing your best to rest and recover. You took a gap year. So this is a very strong virus on its own, even for people that are very healthy. And there are some aspects of being very healthy, which actually also set you up for this more long-term presentation. And that is having more ACE receptors in your heart and lungs and cardiovascular system. Not ACE2, yes, ACE2 receptors, which is one of the receptors by which COVID enters. It also can potentially enter via the acetylcholine receptor, which is interesting around, again, like the ability to regulate your autonomic nervous system and kind of settle your system. And it's really interesting that one of your anxiety symptoms was heart palpitations and passing out. I've seen this often that another expression of long COVID is a combination of hypermobility, dysautonomia, and mast cell activation, which is kind of another immune dysregulation, which causes rashes and allergic type presentation. So you said you were a dancer, which is very common. Any history of that you're like specifically that you're aware of around chronic rashes, allergies, excessive flexibility, things like that?
Actually, I meant to mention that my eczema has been the worst it's ever been since like December or winter of 2022. And I've had eczema issues that I have not had since I was young in this past year and a half. And then also over the summer, I brushed to get some poison ivy in a strawberry patch. And it took me like 2 months for my body to finally get rid of the rash. And I used so many treatments, and it spread, and it was a very severe reaction to that. And just my overall allergies have just increased. So that's something I've been dealing with. As far as hypermobility, I do have a sibling who is underneath the Ehlers-Danlos umbrella diagnoses.
Mm-hmm.
They originally diagnosed her with Marfan's as a child, but they've been kind of second guessing that diagnosis and doing some more genetic testing. But I do have some ligamentous laxity in my hands that I've noticed, in my finger joints, and I just am generally hypermobile in some areas, my spine especially. During my musculoskeletal diagnosis class this past summer, they would use me as the example for a hypermobile patient that you might need to work a little differently on compared to a more stiff patient.
Yeah.
So
Being careful of those little joints. Yeah.
Right, totally. And that's kind of why since I've been in physical therapy school, I've been much more focused on strength training, because I've seen that longitude of, oh, they were really hypermobile as a kid, super flexible. That was their like party trick. And now they have joint laxity and subluxations as they age because they didn't strengthen those joints. So that's kind of been a focus of my strength training. But long-winded answer to, yes, I do have some of those things.
Yeah, that's really valuable. I've seen that many, many times among people in our clinic who are vulnerable to the more long COVID expressions. So now that we kind of know the backstory and some of the red flags of vulnerability that you experienced, how do we move forward? So in our practice, we use essentially this 7-step systematic approach to help people really just recover each system, because COVID and these other viruses and bacterial infections that you've had continued to kind of knock down the immune resilience. And the immune system doesn't just function separately and independently of the other systems. We have to work with all of the systems together. So step 1 is really helping with nervous system regulation, because if we live in a sort of a upregulated, so there's 3 states of the autonomic nervous system. Sympathetic upregulation, which is that kind of active, tachycardic, anxiety. Freeze state, which is dorsal vagus nerve activation of the parasympathetic nervous system. So that's like someone who just finds themselves like stuck, can't move forward, can't take a lot of action, like just stuck in doom scrolling, the brain just feels stuck. Or ventral vagus nerve activation of the parasympathetic nervous system, which we know of as rest and digest, calm aliveness. When the autonomic nervous system is in that state, we can live this sort of calm, and that's the state that the body can then do its healing work in. So being in the midst of physical therapy graduate school, this is a challenging thing to do. But would you just on a day-to-day basis, how often are you in each of those 3 states?
So I'm in a little bit of a curriculum change right now. I think if you'd asked that question a few months ago when I was kind of in like it's like the semester they warn you about, I would have been in probably almost constantly in sympathetic nervous, like the sympathetic response. I would do school from when I woke up. Like class ran from 8 to 5, and I would typically do homework and studying until 11 at night, and then I would go to bed and wake up around like 6:30. So I feel like every waking hour was school or stressed or trying to figure out how I'm going to fit in my life outside of school. But right now I'm in the bridge period to clinical rotations. So my class schedule is decreased. I'm able to find moments where I can pick up my hobbies again. And I've been trying to be mindful about finding moments where I force myself to put away the phone, try and get into that calm state. But I live in a sympathetic situation a lot. A lot of just like constantly having to like unclench my jaw, slow my heartbeat, do some like diaphragmatic breathing to slow everything down. I'm pretty conscious of that throughout the day, especially at night. I do that a lot I count down from 100 with diaphragmatic breathing to fall asleep at night typically. So just who I am, I live in that sympathetic state, that kind of high anxiety, high always on state, but I am better compared to a few months ago at getting into some rest and digest states, chilling out a little bit.
Yeah, that's really, really good that number one, you have some awareness of it.
Mhm.
And number two, that you already have some tools. Breathwork is one of my favorites
Mm.
because it's readily accessible. Everyone can do it. I strongly recommend one of the things we use in our practice is a watch or a ring to help monitor your heart rate variability. Do you have anything like that?
I do. Yes, I wear Apple Watch every day.
Okay, great.
Yeah.
So monitoring that and maybe even just like setting a little timer every couple hours and doing a bit of breath work,
Hmm.
just noticing when you're in that sympathetic upregulation and practicing learning to live in calm aliveness or ventral vagal activation will be a really valuable skill for you as you navigate a clinical career because as we mentioned earlier, there's some levels of mitigation, like being in a hospital, having access to PPE, that sort of thing. But living in that ventral vagus state will help give your immune system more resilience because when you're living in a sympathetic state, your nervous system is actually activating your immune system to be kind of in that chronically inflamed, high alert state and relatively higher blood sugar because it's going to be, the immune system preparedness of fight or flight is evolutionarily about an active immune system in case you encounter a bug or whatever, or you get injured, literally running from a tiger.
Hmm.
But that's not adaptive long term because it does shift people into a more chronic inflammatory, a slightly dysregulated metabolic situation. And one of the newest papers that's come out around long COVID and metabolic health is that taking metformin with an active COVID infection can reduce long COVID risk by 40%. So that's a useful tool potentially to talk to your physician or your medical team about, but also if in case you ever get long COVID again, which I think most of us will probably at some point, but also on a regular basis, using your nervous system as a tool to rest your immune system. Does that make sense?
It does. It does.
So I would start with that. And then our next step is we think about your particular goals. So health is a continuum, right? There's one end of the continuum is death, but the other end, optimally healthy is a highly variable and subjective state. So I would love to hear from you. What is your definition? Like if you could wake up in 6 months from now and feel resiliently healthy, what would that look like to you?
I'm trying to, I think this morning or earlier today, I was in the gym and I was like so weak compared to what I typically can do, but I start my period tomorrow. So I guess within the laws of my menstrual cycle and all that it governs for my body, I think being healthy would be able to each day accomplish the physical activity and exercise I set up for myself, so I can strengthen myself and become strong within my subjective definitions of strong. I think it would look like being able to enjoy public spaces and high groups without having a kind of underlying fear of if I'm going to be sick in 3 days, because I do currently have that. In grad school, my main income has been babysitting on the weekends,
Mm-hmm.
and I absolutely adore kids and I adore babysitting. But same thing, they cough and I'm like, oh my gosh, am I going to miss a week of school now because my body can't fight off what it used to fight off?
Yeah.
So I think feeling healthy, strong, able to do my exercises, but also just being able to go a few months without getting knocked down in bed for a week sick. Because most of
Yeah.
my gaps have been like, I'll get really sick, I'll be recovering, I'll make it like a month and a half, and then the same thing, start cycling over again. So
Yeah.
I think that for me, health would be waking up, able to go about my day with high energy levels, not need a nap throughout the day, not rely on heavy amounts of caffeine, and then have confidence in my immune system to protect me against the daily amount of germs that I come into encounter with.
Yeah. Yeah. That's a beautiful vision. And I think there's a lot we can do to get there. All right. So that's the vision we're going to hold on to, that you feel a sense of resilience, that you're also more physically resilient and strong and able to tolerate exercise. One of the things that I noticed with my long COVID experience was I didn't ever really feel hypermobile, but I was always very strong. I was a gymnast as a kid and I've lifted weights like my whole life. And then suddenly I couldn't really exercise for several years. Then the hypermobility, vulnerability was expressed. And I think you're seeing that same thing too. Like you were a dancer, you always exercise. Now you see the real value of strength training. And I think that's key. For some people with long COVID, they cannot strength train, at least not yet. But since you can, and we're going to work on your mitochondria a little bit more to give you even more capacity for that. And what I might suggest is that we integrate more recovery. So you think of yourself a little bit more as like a professional athlete. I watched a wonderful documentary on a number of NFL quarterbacks recently that was really inspiring. And they get in kind of a car crash every weekend for, think of the hits they take for whatever long the NFL season is. Then one of their trainers was talking about how like day one post game is really about mobility, which is balance. And this well, being a physical therapy student, balance, mobilization of the fascia and the joints and the tissues around the muscles, and not so much heavy strength training, just mobilization, gentle stretching, and mobility. And then the next day is about agility. So you're going to be lifting weights, but lighter weights with more challenging positions. So let's say you get knocked off kilter, you're lifting multiple functional movements, not just one isolated strength training exercise. And then you could use the rest of your week to, and so that could look like day one is maybe a Pilates session or something similar to that, or a mobility session. Day two is more functional movement. Day three might be lower quarter. Day four might be a complete rest and recovery, which could utilize some of the restorative tools like cold immersion or red light photobiomodulation therapy to help give the mitochondria and a boost and the inflammation suppressed. So those are some tools that I find really valuable. For those that struggle with exercise at all, because it's like you can't get oxygen to your muscles, it doesn't sound like that's really your situation. Would you agree?
I would agree, yes.
So some people post-COVID feel like they can't really get oxygen to their muscles. For them, and for this like deep fatigue, I do really like a longer term recovery period, probably for a couple months before starting any progressive exercise, with hyperbaric oxygen and red light therapy to support getting oxygen to the tissues and to support the mitochondria. But for your case, I don't think that's necessary. I think the tools would be more about anti-inflammation and slow pacing of what you really dividing up your exercise bouts. So there's like a recovery day almost in between every exercise day. It could be mobility, but not heavy lifting more than 3 to 4 times per week.
Right.
But doing that, I think, if as much as you can tolerate, will be good to help getting that stability back. And walking in nature is like your best friend. Swimming would be fine too, but lots and lots of outdoor walking. And Duke has a beautiful series of trails, right?
Absolutely. Yes. Yes. The gardens are perfect right now. So
yeah. Oh yeah. And it's spring. I mean, perfect. Absolutely. I used to work at Duke Hospital a long, long time ago.
You take your breaks in the gardens, I'm sure.
Yeah. Yeah. My husband used to be off every Friday and he would like love that because he would just come over there and run.
Absolutely. Yeah. It's a good area, the community as a whole, for getting outdoors. I do try and make that now that it's getting warm, at least during the winter, I can't say that I focused on that.
Absolutely. Well, so those outdoor, so I like to call it mindful cardio, will also help with shifting you back into that rest and digest, calm aliveness state. So walking rather than high intensity cardio, because we do have research on athletes that heavy training does suppress the immune system.
Wow.
So for you, there's going to be this nice balance between maybe 3 to 4 days of strength training, mobility and recovery, and gentle flexibility of the muscles more than the joints, and lots of outdoor walking to your tolerance. but really limiting things like running and spin class and stuff like that until we recover your immune system to have more resilience.
So how would I know that I'm recovered?
Well, one step would be don't get an infection
Right.
let's go with like 6 months without an infection, and then we'll consider
Right.
a little bit of heavier exercise.
Have some more faith in my immune system. Okay.
Yeah.
I've been like kind of following 5 on, 2 off for my week of exercise. And I separate my systems in terms of upper body, lower body, core, and then cardio. But I definitely could put some more gaps in there, I think.
Yeah, I think a focus on recovery will be good because we're looking at optimizing your musculoskeletal and cardiovascular fitness, because also your cardiovascular system we need to talk about in a minute, but we don't want to push it too hard, because right now your general immune system is suppressed, and we really need to improve that, because it's not just COVID. You're also dealing with, pneumonia history and bacterial infections, viral infections with the flu, Epstein-Barr. So it's just generally suppressed. We need to take care of that. And then so in step 2, we've defined your goals. Step 3, and even further refined, as like, let's go 6 months without any kind of illness is like another key, a kind of an action step, something
I would
we can
love to just
know.
have allergies for these next 6 months. That'd be like if my only complaint for the doctor was allergies, that'd be like my gold standard.
Right. Allergies or less. Let's try to get rid of the allergies too. We're going to talk about that. And then have you done any kind of testing? So we know your story. Have you done any lab testing that was significant?
So after the viral infection in January of 2023, I did a CBC. That was kind of, nothing really came up on it. My white blood cells were elevated and a few things were kind of off, but nothing significant. However, February, when I went back in after, because I had the flu in January, and then I had this spike a few weeks later where my fever went back up high after I was complete with the Tamiflu. And I was like, please, just do a full lab workup. And that was conclusive for high white blood cell count, but they said it wasn't enough to be extremely concerned, and it just matched the picture that I'd just been sick. And I'm sure we'll speak to this, but every single doctor that I've been like, this is not my normal, like something's wrong, they've been like, well, you're stressed. And so I'm like, or my new like annoying thing is people love to tell me, you just need to go eat some oranges or something, like you just need to get your vitamin C up. And I'm like, you don't think I'm thinking about those things? I've been sick for a whole year and a half. But yeah, so the doctor ran a bunch of blood work. He had a CBC, a blood plant panel.
Were your lipids looking good?
Everything looked fine, yeah.
Was your vitamin D level tested?
I can pull it up right now.
Okay, great.
The only thing they pointed out was the white blood cells.
Okay.
And then that my chest x-ray was normal.
Well, that's good.
There was no follow-up from that appointment. I looked at the results myself and just...
Oh, they didn't even really talk to you? That's terrible.
They called me that my chest x-ray was good. And then that was, I think, all I talked through with them.
While you're looking up that data, this is a quick time to note that, look, if you are struggling with long COVID or chronic, what feels like you're getting sick all the time in this COVID experience of lifetime, I guess, in history, the medical gaslighting is intense. And I think it's because the medical community just can't wrap their heads around this. It's too overwhelming to think about that COVID is not going away, and it's not really going to weaken, or at least it hasn't yet weakened and become similar to the flu. It's a very difficult virus, and it's impacting people really in a large way. And I think just people who are having to deal with it day to day just can't. There's a lot of cognitive dissonance going on. So it's not you, it's them. Okay. Any vitamin D info? Did they test that?
So I'm looking through this now. I'm not seeing vitamin D, but it does show, I forgot this, that my neutrophil count was really high and my lymphocyte was low. Neither of those were insane, but both rang up as high neutrophil, low for lymphocytes, and my white blood cells were pretty high, coming in at 12.5 with normal being 9.8. Let me check this one other one. I'm not seeing vitamin D tested. I have a comprehensive metabolic panel and a complete blood count. Those are the two they gave me.
Okay, so the CMP, how was your fasting glucose?
My glucose was at a 79.
Okay, that's good. So we have the story, we have the picture, we know kind of your underlying vulnerabilities. We talked about the exercise piece to being less stress to your immune system and your nervous system. We're going to add in breath work a few times a day, tracking your stress. Now, as we go through the systems, so we talked about nervous system. Really, a key recommendation and strategy for you is to keep bringing that nervous system back into rest and digest using the tools that you already have. And we can always expand on that. And then we're using exercise as a nourishing thing, a strengthening of the musculoskeletal system, especially the joint stability and that mindful cardio. And then we start thinking about the immune system is about 70 to 80% intertwined with the digestive system. And so we have to think about the gut microbiome and the digestive function. So if you think about your digestion pre all of the sickness, how was it? Normal bowel movements, any abdominal pain, any bloating, any heartburn, any kind of digestive issues ever?
Yes. Especially in college. I don't recall a lot from when I was younger. I've always had just kind of a more like sensitive stomach. But in college, within my first about 2 months, I went from eating dairy all the time to not being able to tolerate it. It would just kind of give me a stomach ache and kind of like give me a headache. And then by my sophomore year, I would like throw up for 12 straight hours if I had dairy.
Okay.
And that summer between sophomore year and junior year, I was at my parents' homes that summer. And every 72 hours to 3 to 4 days, I was throwing up like violently, and they couldn't figure out why. They did all these tests to see allergies. Nothing was showing up as allergic. They diagnosed me with GERD, which I didn't really necessarily agree with, just because I didn't really fit the demographics of that diagnosis. But I think all they could reason was that I was throwing up a lot. I was having constant acid reflux. My like weight was dropping just because of constantly like couldn't keep anything down. They gave me a bunch of food restrictions. I followed the FODMAP diet for a while. And for about a year, I worked on like healing my gut. So sophomore to junior year was like completely just, I had like, could eat no pepper. I didn't eat garlic. I didn't eat tomatoes. I didn't eat onions. I ate like bland, plain pasta, unseasoned chicken, just the most boring diet you can imagine for that year to kind of heal my gut. And I was no longer getting sick, but I never had an answer. And they also put me on omeprazole for that whole year, which I was really not super happy about. It has a lot of side effects and a pretty rough long-term effect of that medication on my liver, my kidney. So I was kind of focused on getting off that as quickly as I could. So I was extremely sick for about a year, constant bloating, really severe abdominal pain, IBS symptoms. It'd be between IBS-C and then IBS-D back and forth, and then just like throwing up so frequently. And like I said, it wouldn't just be like throwing up one thing. It'd be like I'd have to empty out my whole system every few days. Never really got answer for that. Eventually it went away. I'm back to eating normal now. There's some things I hurt my stomach more than others, but and they never have understood why dairy makes me as sick as it does, because I'm not allergic to it, and I'm not. So I guess they just kind of figured lactose intolerant like some of the other people, but I don't know. So GI has been a huge part of my life most of college. That's like what would have been my most significant complaint.
Interesting. So are you on any medications now other than the hormonal birth control?
I am on fluoxetine 20 milligrams for anxiety. And I had an eating disorder about that same time when I was throwing up constantly freshman year through that, which obviously that being told there's more and more things I can't eat was pretty hard.
Yeah.
Because I was already kind of restricting. And so they put me on that for anxiety control, and I've been on it since.
Okay. So absolutely optimizing your digestive resilience could really be key to helping your immune resilience. And how we do that is, do you struggle with any kind of constipation?
Only on my period.
Okay. So we want to make sure so I always start with what call opening the windows and doors. So if anyone listening is dealing with constipation, that's the first step of getting things moving. And then we think about how you eat as much as what you eat. So I wouldn't, with a history of eating disorder, really think about a lot of restriction. Instead, I would be thinking about what to add. And at first, we want to add things that are very easy to digest, that you feel comfortable cooking in your sort of grad school life, right? So I often start 3 meals a day, even with soups or stews. It's easy. You could bulk cook it. You could have it for breakfast, lunch, and dinner. Broths, bone broths in particular would help. We probably, in your case, need to start healing the lining of the small intestine. So bone broths can be very nutrient dense. Then we can add cooked vegetables, cruciferous vegetables, really good for the liver and to feed the gut microbiome. Leafy greens, everything like asparagus, mushrooms, and all the non-starchy vegetables, but also things like squashes or sweet potatoes and sources of protein. In your case, I would do a nice, almost a Mediterranean balance between animal proteins from as clean of sources as you can get, because we need to add nutrient density for you, especially if you're trying to build strength. But also there's a lot of healing to do, and the body needs some protein for that, amino acids at least. And then layer that with, beans and lentils. Again, I think they're going to be easiest for you to digest with the least bloating if we do them in soups. But it's okay to eat like the occasional Eden brand, for example, which is a canned bean brand, makes them with with kombu, which is a kind of seaweed, which helps with their digestibility. So, later in the later, like summer to early fall, you may be better able to tolerate more salads, and you could add some cooked lentils, some beans from Eden or some cooked beans. Chickpeas have actually been shown to reduce COVID risk because of the type of fiber in them. So there is such a thing as I actually read a recent book by a gastroenterologist. I forget where she was practicing. It might be Johns Hopkins. Antiviral gut, if you will. And there is also some good research that the risk of COVID is decreased with a plant-based diet. In your case, I probably wouldn't go entirely no meat or no animal products, because I do think you need the amino acids that are more bioavailable in animal proteins. But you can still be very plant heavy. And the reason why that's so good for the gut is it actually helps build the beneficial microbiome, which is a key part of your immune system, but it's also a key part of the gut microbiome heart-brain axis. So a lot of your symptoms beyond the fevers are things like tachycardia and dysautonomia. And the healthier the gut microbiome is, the healthier your heart will also be, your heart rhythm. Does that make sense?
It does. It does.
Because as the gut microbiome is essentially more diverse, more robust, more grounded, and that will help in a more optimized immune system, the gut microbiome also has direct conversation with the brain and the nervous system, which regulates the heart rhythm. So that heart arrhythmia stuff is not always a heart issue as much as it's an autonomic nervous system issue. Does that make sense?
It does.
And so I would really suggest that we think about a varied diet for you to your tolerance. There's really I wouldn't limit. In fact, I would add anti-inflammatory herbs and spices, but you could start with things that are less spicy, like rosemary and ginger and cinnamon. Fennel is really nice for adding digestive enzymes. And then how you eat is another opportunity to shift to that calmness, rest and digest, eating, sitting down, undistracted, chewing really thoroughly, like 20 times per bite, and then allowing the system to really move. I would also support in your case, and we may not have time on this episode to get into all of the supplemental recommendations yet, but, adding some, since your acid was suppressed for so long, and now you have some energy suppression from this chronic infectious issue, adding just a little bit of diluted apple cider vinegar before each meal can help stimulate stomach acid, which we need to prevent some of these more bacterial infections to the gut. So, which could be a part of why you were chronically nauseous. There's a lot that could be going on there. Could be some food sensitivities, could be an autonomic nervous system thing. But having enough stomach acid is actually really important to activating B12 and to activating the enzyme that helps with breaking down protein. And then digestive enzymes can be really valuable. And there are lots of great quality brands of digestive enzymes. I like Seeking Health for people that have this more histamine picture. You were talking about the enzyme, the eczema flare. So Seeking Health is a company that most of their enzyme products, there are two enzymes I could take with them with food, are good with a histamine picture. One is a DAO enzyme. I think they call it histamine digest. And the other is just their general digestive enzymes. But there are lots of great companies that make digestive enzymes, Designs for Health and Transformation Enzymes and Enzymatica. There are lots of good ones. So adding some support for your digestive juices, because those take a lot of ATP, and your mitochondria are suppressed by all these chronic infections, right? You're more fatigued. So if we can boost that a little bit, that can be really valuable. And then just movement, right? This is where the mobility comes in for gut motility. Walking is really helpful for consistent gut motility. Even a little bit of caffeine in the morning. I'm not opposed to that in the short term for you, because, we've got to kind of keep it going. But adding more nutrient density, eliminating or reducing things like sugar, alcohol, and processed grains is going to be very helpful. But we do that. We make this shift over a couple of weeks to a couple of months to your tolerance. And so that will support digestion. The other thing that we can do to support like mobility and motility of digestive system is visceral physical therapy. We could also use things like castor oil packs and just simply making sure you have like a nice squatty potty, your bowel function is regular. As you know, the brain and the bowel routine. So that routine is key. And even just like your morning routine, your evening routine. And then if we circle to the cardiovascular system, there is an impact in most cases of COVID to the vascular system, because that's one of the places where it comes in. And we do know that there's clotting risk that's increased post-COVID, and there's risk to the vascular epithelium, which is why people have risk of younger strokes or just other kind of microclots that can make it harder to get blood to the muscles, which is another reason why people struggle with exercise tolerance. So from a nutrition standpoint, one of the ways we can support that is using things like beet powder, greens and reds powders. And then specifically, there are two products by a company called Calroy, is the supplement company. And one is called Vasconox. It's a version of beet powder. So you can just get beet powder at Whole Foods. That's one option. But there's also a little bit more specificity to that, which helps with the vascular nitric oxide. So your ability to expand those vessels, which also, by the way, can come with that slow breath work. So there's lots of ways we can improve nitric oxide. And then to heal the lining of the arteries and the vascular epithelium, we can use things. The other product by Calroy is called I think it's called Arterosil or something. It's something that looks like artery. But you can also just use what it's really made of is a lot of polyphenols. So we can be thinking rainbow diet for the digestive function and also for the immune function, but also to heal the vascular epithelium and really pacing the exercise to your tolerance. And then so we've talked about cardiovascular health. Oh, the other thing that can really help with cardiovascular health is omega-3 fatty acids.
Mhm.
So either eating sardines or taking fish oil or SPM mediators, which is like a very concentrated version of fish oil. Metagenics has a good SPM mediator. I don't have any ownership of any of these supplement companies. They're just some good quality brands. And, anyone can ask me questions about that. But I would suggest that we really think about building the quality of your diet as a way of really optimizing your recovery. And then the other thing that can help is there are 2 lab tests I would suggest you ask your medical team for. One is your vitamin D level. Vitamin D is very protective for the immune function. And the other is any measures of inflammation they're willing to do, whether that's homocysteine, CRP, HSCRP. And it can be valuable after 2 COVID infections to look at your D dimer just to be mindful of clotting risk. It doesn't sound like you're not really presenting with that sort of a picture, the kind of microclots and clotting.
Mm-hmm.
In fact, it doesn't really seem like a major part of this conversation, but I think anyone who's had, 3 mRNA vaccines and 2 infections within 3 years, it's just at risk for that. So it's worth checking your D dimer at the minimum. We can also look at other clotting factors for people that have more challenges with clotting, like fibrinogen and things like that, or if you have a genetic risk factor for clotting. So I think given your key goal of energy, the last thing I want to talk about is mitochondrial function. So red light therapy is more and more accessible in like recovery type gyms. Do they have anything like that in Durham these days?
There are a few recovery centers, so I can see if they offer it. I've never looked
Yeah.
at it before.
It's worth looking at. That could be valuable. And with the chronic viruses of things like Epstein-Barr, and if you have other chronic issues, like you said, like in the dorms, perhaps mold was an issue or things like that. IV ozone can be helpful for sort of cleaning up sort of some of those more chronic viruses and underlying toxins. So some of those recovery gyms will also offer low dose ozone therapy or a naturopathic clinic, which I do like. I like to start with low dose because it can make your symptoms a little bit worse before they get better. So we've talked about, and then the other thing to support mitochondrial function is CoQ10, urolithin A, or NMN, nucleotide mononucleotide. It's nicotinamide mononucleotide. It's a form of a B vitamin. Also helpful for longevity. So those are some nutrients. Now, urolithin A is actually developed from the gut bacteria. So the stronger we get your gut bacteria, the better, starting with food. And then there are some specific probiotics and things which I would recommend adding, but let's add these in one thing at a time. This is going to be more than enough for you for a while. And for anyone listening who wants to do more of this, we teach this in detail in our functional nutrition course. So there are lots and lots more supplements we could dive into and strategies, but we don't want this episode to be 2 hours long. But for now, I think dialing back your exercise, really focusing on recovery, rebuilding the gut microbiome, and you could gently do a little bit of probiotic food if it doesn't flare your eczema. There's a gentle balance between histamine and fermented foods. So the biggest driver of histamine is going to be things like alcohol and processed meats, but sometimes those fermented things like sauerkrauts and even dairy-free yogurts, just be mindful of how it impacts your eczema. And then for the mitochondria, rest in between, but also the nutrients of mitochondria. And urolithin A in particular is made by the gut bacteria. It's hard for us to know if you have the right species to make urolithin A. So you could take that as a supplement. But if you do, and you could just test this and see how your energy goes after a few weeks, simply eating more foods that feed the gut bacteria that make urolithin A. So that's things like berries and pomegranate, cranberry, stuff like that, colorful berries help to feed that. So you could add some of those gut friendly nutrients, like make a chia pudding and then add berries and pomegranate seeds and things like that. How does that feel as a place to begin?
Good. Some of those supplements, vitamins I've already been taking, and I do take, and I do a lot of like cold. I have a juice maker machine, and so I do a lot of those.
Oh, good. Yeah.
And I actually have a friend that we made beet juice recently, so I think I might just find recipes where I can add that in more regularly.
Yeah, that's great.
But it all feels very doable. I do have one question. So one time I tried the apple cider vinegar before, and I just didn't like it. Could I do a gummy? Is that okay? Like apple cider vinegar gummy?
Yeah, you could. Or you could also just really dilute it. So it's like 1 tablespoon of apple cider vinegar to like 8 tablespoons of water. Okay. But yeah, they also have apple cider vinegar gummies and capsules and stuff.
I guess I have to see how much sugar is in those. Yeah, maybe capsule would be better.
That's the only downside because we're trying to, remodel the gut. But yeah.
Right. Okay. Yeah. Perfect. Yeah. And I do have I use Orgain protein products, and I have their immunity juice powder, which has like so
lots
many
of greens and red powders. Yeah. Love that. Yeah. So greens and reds powders can be good. And I think for you, given your history of kind of dropping weight and, adding some protein, the other thing that could be very valuable to add right around your workout is between 5 and 20 grams of creatine. Okay. So creatine is kind of another nutrient that helps build muscle and bone. And they've tested this. It's a very safe nutrient that's been tested in postmenopausal women who had osteoporosis. So I really like that during the 20s when you have your opportunity to still build up.
And is there a decision, is there better or before the workout or after?
It's any time within 30 minutes to about an hour and a half around the workout. So what I tend to do is just sort of put it in my workout water bottle and just drink it during the time of the workout.
Perfect.
So, and then the final thing I want to mention before we wrap up today is we do have to think in terms of mitigation, because ultimately the fewer infections you get, the better. So now that it's summer, one thing, when you're in classes or in clinicals or things like that, it would make sense for you to wear a mask, at least for the next 6 months while we're healing your system. We can reassess that. Or in public, like at a movie theater or whatever, indoors with a lot of people. Absolutely. Your best protection is a mask. Okay. There are a few nasal sprays on the market. I'll put those in the course too, that you can use. One of them is called Enovid, but there are others too that have been shown in clinical research to clear a lot of COVID from the nasal passageways. But, so that's something good to have on hand. But I do suggest a KN95, an N95, or a KN94 mask respirator anytime you're in an indoor situation with other people, because just all of our other mitigations have been minimized. Now in your own home, or when you want to deliberately meet up with people, you can use HEPA filters. And the safest thing, one of the best ways, is just more outdoors. Yeah. And so I do think it's important that we keep within the conversation these mitigation factors of HEPA filters, far UV light, nasal sprays. They're CPC mouthwash, which I believe is in Scope and Crest, a lot of the main brands. Again, if you've been exposed or you've been around people and weren't masking for whatever reason, you can also just rinse your mouth with the CPC mouthwash. I don't suggest doing that every single day because we want to really strengthen the mouth microbiome. So you can brush your teeth with dental Sidin, which is basically an herbal toothpaste. Use oral probiotics. because we want to build that resilience from the mouth all the way through the digestive tract. But, if for whatever reason you find yourself in a room, with a lot of unmasked people or you might have been exposed, it's another little mitigation tool. So
Right.
there's not one perfect mitigation tool, but I think we need to keep those within the conversations around our closest friends. And the simplest way to do it is just be like, I've been really sick for 18 months.
Mm-hmm.
I'm working with my health team, and my first goal is to be virus free for the next 6 months. So I'm going to commit to doing what I need to do, including sometimes wearing a mask or only meeting with you outside. Luckily, we're stepping into spring where you can meet for brunch outside.
Right.
How does that feel? I know it's really hard to do those things.
No, I think it's going to be hard, but I think also I'm entering a season of school where that's going to be easier than it might have been earlier. That's also, like you said, this is not a sustainable way of life where I'm getting seriously sick and relying on antibiotics or antiviral medications just to get past each one. The pneumonia and the mono both really took a hit on me. So,
yeah. And I really think in your case, optimizing your gut microbiome is going to make a huge difference. That's going to take a little time to remodel that. And then we may later have a conversation about hormonal birth control, because while there's some evidence that it can be protective to kind of stabilize the estrogen levels, it also can dysregulate your gut microbiome. And so we may want to revisit, is that the best birth control option for you now? But I don't suggest we change it for at least the next 6 to 12 months if otherwise it's working well for you.
this has been amazing. Thank you so much. My classmates who heard from you at CSM are all very excited to get my notes, and I guess I can tell them about this podcast episode so they can listen to themselves. But I've just appreciated it so much.
Oh, absolutely. And we'll check in a few weeks or a month or so and see how you're doing. But thank you so much for sharing your story. I'm sure, if you're listening to this and you have a similar story, you're wondering why you've been sick every month for the last year and a half, 2 years, you're not alone. This is really, really common in this, time that we're in. And so, Terry, I really appreciate you sharing your story and being so vulnerable, and it will really help a lot of people.
Thank you so much.
Thanks so much, everyone. We'll see you next time.